MOOC Conversation, Lecture 6, November 7, 2024. Specialist Training. Ming, do you know what the differences are between China and Canada in training specialists? Sarah, I have some idea. In Canada, doctors must complete a residency program after medical school to become specialists, right? Ming, that's right. It's the same in China. However, doctors in China must obtain a licensed physician qualification before starting residency training. After residency, they still need to undergo further advanced specialist training. Sarah, so, how long does it take to train a specialist in China? Ming, about 8 to 10 years, starting from undergraduate studies. To become a senior specialist, it takes additional time and requires passing strict evaluations. Sarah, that sounds thorough. In Canada, it usually takes about 10 to 12 years from the start of undergraduate studies to become a specialist. If doctors want further training, they can opt for additional fellowship programs. Ming, I see. So Canada's training system focuses more on residency and fellowship stages, with certification mainly managed by national medical boards? Sarah, yes, the Royal College of Physicians and Surgeons and the College of Family Physicians are responsible for certification and continuing education, ensuring that doctors' knowledge and skills stay up to date. Ming, it seems like each system has its own features. China's specialist training is more stage-based, emphasizing clinical experience and research, while Canada's system is more standardized. Sarah, exactly. Different training methods, but both aim to ensure that doctors are well qualified to provide high-quality healthcare to patients. Comparison of special access mechanism. Li Hua, Emily, do you know the differences between China and Canada in terms of specialist referral mechanisms? Emily, I know a bit. In Canada, if you want to see a specialist, you usually need a referral from a family doctor, right? Li Hua, yes, in Canada, family doctors are the main entry point for patients to access specialists. Without a referral from a family doctor, it's difficult for patients to book an appointment with a specialist directly. Emily, what about in China? How does the specialist access system work there? Li Hua, in China, patients can go directly to a hospital and register to see a specialist without needing a referral. So, many people choose to go straight to the specialist departments at large hospitals. Emily, oh, I see. That way, patients can see specialists more quickly, but it must put a lot of pressure on large hospitals, right? Li Hua, exactly. That's why China has been promoting a tiered healthcare system in recent years, encouraging patients to visit primary care facilities first, and then be referred to larger hospitals if needed. If the condition is complex or requires specialist treatment, doctors will recommend the patient to a higher-level hospital. Emily, that sounds a bit like the Canadian system. We go through the family doctor first, who screens and then refers patients to specialists. This helps optimize medical resources so specialists can prioritize more complex cases. Li Hua, yes, both have pros and cons. The Chinese system allows patients direct access to specialists, but it can lead to overcrowded hospitals. The Canadian system is more organized, but it might involve longer wait times. Emily, it seems like both systems aim to use medical resources more effectively and meet different healthcare needs. Li Hua, exactly. They're suited to different countries and healthcare conditions. Methods of referral to a specialist. Li Ming, Alex, besides going through a family doctor, what other ways are there to get a referral to a specialist in Canada? Alex, the family doctor is definitely the most common way, but there are other options, like referrals from the emergency department. For example, if a patient has an acute heart issue, they can go to the ER, and the ER doctor can directly refer them to a cardiologist. Li Ming, got it. If a patient doesn't have a family doctor, can they get a referral through a community health center? Alex, yes, they can. Community health centers provide primary care services for people without a family doctor. If they think a patient needs specialist care, they might help connect them with a specialist or recommend seeing a family doctor. Li Ming, Alex, besides going through a family doctor, what other ways are there to get a referral to a specialist in Canada? Alex, the family doctor is definitely the most common way, but there are other options, like referrals from the emergency department. For example, if a patient has an acute heart issue, they can go to the ER, and the ER doctor can directly refer them to a cardiologist. Li Ming, got it. If a patient doesn't have a family doctor, can they get a referral through a community health center? Alex, yes, they can. Community health centers provide primary care services for people without a family doctor. If they think a patient needs specialist care, they might help connect them with a specialist or recommend seeing a family doctor. Li Ming, what about private clinics? If a patient is willing to pay, can they also book a specialist directly? Alex, that's right. In fields like mental health, plastic surgery, or physical therapy, patients can pay out of pocket to see a specialist at a private clinic. These costs are generally not covered by the public healthcare system. Li Ming, this is very helpful. It seems Canada has quite a variety of referral methods to accommodate different needs and situations. Alex, exactly, each method has its purpose, allowing patients to access appropriate specialist care in different situations. Most common types of specialists. Ting, Lisa, do you know what the most common types of specialists are? Lisa, I know a few. For example, cardiologists specialize in treating heart and blood vessel diseases, like hypertension and heart disease. Ting, that's right. There are also neurologists who mainly diagnose and treat disorders of the brain, spinal cord, and nervous system, like epilepsy and strokes. Lisa, oh, and dermatologists. They handle health issues related to the skin, hair, and nails, with common problems like eczema, acne, and skin cancer. Ting, ophthalmologists are also common. They help patients with vision issues, like glaucoma and cataracts. Lisa, and gastroenterologists, who specialize in digestive system disorders, like gastritis, irritable bowel syndrome, and liver disease. Ting, exactly. It seems like each type of specialist has a specific role to help patients with different health issues. Lisa, yes, so if there's a specific health issue, it's really important to see the right specialist.